And it is the voice of Indiana County, WCCS 101.1 FM and AM 1160. I guess after hearing that commercial with the voice of Dr. Darrell Rubin, the question is, Dr. Rubin, can you tell me more? And he can. He's on the line with us this morning. Our conversation here during Heart Health Awareness Month, brought to you by Marcus & Mack, voted best personal injury law firm in the Best of Indiana County contest. Marcus & Mack, a law firm representing injured people. Dr. Rubin, good morning.
Good morning. How are you?
Wonderful, and it's good to have you with us here today. We just heard that spot there talking about cardiac care at IRMC. You've been there a while now, and I'm sure that as you have been there for about a year now, you've learned more about the cardiac care programs at IRMC. Still just as impressed as you were last year when we talked with you?
Absolutely. Absolutely. I think that Indiana Regional Medical Center Cardiology is doing an excellent job taking care of the cardiac patients here in this community.
Well, one of the things about a cardiologist, which is the role that you perform, is routine cardiology care. I think as we get older, we think that, well, maybe, until I have something happen, I really don't need a cardiologist. Is that really the case, or should we be seeing a cardiologist on a routine basis?
Well, certainly the people who've had events should be seeing a cardiologist on a routine basis. Other people who would benefit are those with sort of difficult to control high blood pressure. And then even people with questions. Like I've definitely seen some people who have family history of cardiovascular disease, and they're concerned. And so that is enough of a reason to come in and have a conversation. And some of those people I follow, and some of them I say, well, it looks like it was good for us to have this conversation, but at this point the best thing is just follow up with your primary care physician. And usual care, which, for me, the top line is diet and exercise.
Mm-hmm. Mm-hmm. Now, are we talking a certain age at which they should come to see you, or especially you mentioned family history, a certain age in relation to what has happened in their family before? Help us to define that.
Yeah, so age. Certainly some younger people have significant cardiovascular problems that need regular cardiology follow-up. And those people tend to be identified early because they have an event or, they're identified as children. Some of my younger patients have difficult to control high blood pressure. Mm-hmm. And I think, high blood pressure, by itself drives a lot of cardiovascular morbidity. And this is a known thing. And because high blood pressure tends not to hurt at the beginning, it can sort of go uncontrolled for long periods of time. But once it's identified, then we have to sort of be careful about getting them on the right medicines, adjusting the diet, encouraging exercise, so we can get it under control before people have strokes or heart attacks. And, I mentioned that because high blood pressure can start really young.
Uh-huh. Uh-huh.
There's been some talk about it starting, among children. I'm an adult cardiologist, so I don't deal with children. But certainly that group, as they move into the adult population, would be well advised to, pay close attention to whether their blood pressure is controlled. And usually, for me, that involves checking the blood pressures at home periodically. Mm-hmm. Not everybody needs to do it every day, but having one of these automatic blood pressure cuffs at home and using it periodically to keep track is definitely good advice.
Physiologically, what does high blood pressure do to a person's body?
Well, it does a lot of things, but the main thing is its effect on the vasculature, on the blood vessels. The blood vessels remodel as they're exposed to high pressure, and over time, that creates issues, not only for the heart but the brain and the kidney, even the gut. It sort of drives this atherosclerosis process, and we know that controlling it, keeping that blood pressure well controlled, and these days, the target that we approach is the top number being 120. Mm-hmm. Now we call the top number the systolic blood pressure.
Okay.
And and that number being 120, that's the target. And I recognize that strict control is not feasible. So the range is where I tend to direct people. If it's between 120 and 130, then we say we're doing well. If it's above 130, then I start looking to either start medicines, add medicines, and certainly to make sure that people are being mindful of how much salt they're taking in.
Mm-hmm. Mm-hmm. What about that bottom number?
Now, the bottom number we call the diastolic blood pressure, and the target there is 80. If you're at 90 or above, that's too high. And so the same rules apply. If their bottom number is in the 90s, we have to start thinking about whether to add or increase medicines, and certainly watching that salt intake.
So there's medical intervention in your blood pressure, but there are other things that we can do that are also going to help us manage our high blood pressure, yes?
Exactly. And I think, it's an important point because we know that having too much salt in our diet affects our health poorly. And sometimes, we're not aware of just how much salt we're getting because, I don't want to say it's hidden salt, but we're just not aware of it. So I tell people to be careful with restaurant food. I tell them to be careful with certainly using the salt shaker at home is a no-no. When they cook, I ask them to start measuring how much salt they use so they have an idea of what they're getting. And then, so all those things kind of work together to give you a picture of, how much salt you're getting in your diet overall. There are other ways. So when we buy prepared foods, oftentimes they'll have a measure. They'll have a measure on the nutrition label that tells you how many milligrams of sodium you're getting per serving. Mm-hmm. And the sort of ballpark is around 3,000 milligrams, and that varies according to who you're talking to, but that's the ballpark.
So high blood pressure certainly is one of those measuring sticks, and when we're formulating a strategy for protecting our heart, our diet in other respects as well. I would assume that your fat content, the types of fats that you're taking in, all of those, and the exercise that you get along with your diet, that's a part of the formula too?
Yeah, exactly. Your rule of thumb, the more fruits and vegetables you eat, the better. Mm-hmm. That's the best thing for you. I'm not against pasta or rice or potatoes. I do ask people to start to measure. How much of that am I getting? And you could be surprised. If you measure how much carbohydrate you're eating, exactly how much you're getting. And that's a practice that I use too in my own life, measuring my carbohydrates. And certainly, once I was aware of how much I was eating, I was able to bring that down to something more fitting for me. Mm-hmm. And so I ask people to start there.
Dr. Darrell Rubin is our guest this morning, cardiologist with the Indiana Regional Medical Center, the IRMC Physician Group. Nonetheless, someone might have great cholesterol numbers. They might have wonderful blood pressure readings. They're going to have a heart attack anyway, due to any number of different factors. So what are some of the signs or the symptoms that we should be looking for when we're guarding our heart health?
The first thing that everybody thinks about, sort of common knowledge, is pain in the chest. And, the universal sign that somebody's having a heart attack is that they clutch their chest. That's sort of the top one. The other things that happen can be shortness of breath when you do stuff. Doing things that wouldn't normally, make you short of breath, like, carrying the groceries in the house, climbing the stairs in your home. If it starts to become the case that your breathing is labored while you're doing it, that may be a sign that you developed some significant cardiovascular disease. Arm pain, jaw pain, particularly when you're doing stuff, can also be a sign that you're either having a heart attack or getting close to it. Less commonly thought of, but still relevant is just fatigue. People feel tired all the time. Now, that's a lot more general, and they certainly, in the mind of physicians, will bring up the idea maybe this person's having significant cardiovascular disease, but there are other things that can cause that too. But it certainly puts cardiovascular disease on the list of things to investigate.
Yeah, and we're talking with routine cardiology care, but there's also the need for emergency cardiac care as well when you have that heart attack, and that trip to the emergency room becomes very, very important, doesn't it?
It does, and I'm so glad that you mentioned it, because what happens is they'll stay home with significant pain in their chest because they think it's reflux or indigestion. And sometimes it is, but I always recommend to people that they go and be evaluated and satisfy themselves that, hey, I'm not having a heart attack before they take medicines for indigestion or reflux to treat it. Yeah.
Certainly, in the ER, you'll get very specialized and very high-intensity treatment because they want to make sure of what they're dealing with. But in terms of your routine visit to your cardiologist, and whether we make this an annual thing or depending upon the health of somebody and how you judge their condition to be, maybe more than just annual. When someone visits you as a cardiologist, what are some of the things that they should expect to be discussing with you?
Well, for initial visits, I try to have a conversation about a lot of things. Symptoms is sort of the first step. It's what usually brings people into the clinic. So want to get an idea of what's happening. I also talk about diet a lot because it's so important in preventing cardiovascular events, and exercise as well. They'll be in a physical exam, which usually involves an EKG and blood pressure, and then we make a plan together. What if any medicines are going to add, whether or not home blood pressure monitoring is something they should be doing on a regular basis, what imaging we need to do, if any, and then follow up. How frequently are we going to follow up?
Yeah. All of those become a very important part of your entire health picture. Dr. Darrell Rubin has joined us here this morning. Dr. Rubin, if somebody wants to come visit you, do they need to go first to their primary care physician and get a referral, or can they come directly to your office or make an appointment directly with you?
I think, sometimes that depends on their insurance. Some insurances require a referral, others don't. But I do advocate for people having a primary care physician. They are very important in terms of their routine health care, and they're there to sort of start the process. But of course we are here and available, so they can always call our office at any point and make an appointment to be seen. But always my communications will not only be to the patient but also to their primary care physician, so that the team is on the same page.
All right. Putting the whole puzzle together. We appreciate your visit here this morning. I know you're a very busy guy, and you've taken some time out to help us understand heart health and its management, and we'll have a wonderful day today.
You do the same, sir. Thank you for being on.
Bye now.
Bye-bye.
It is the voice of Indiana County. It's WCCS 101.1 FM and AM 1160.